From KGW News, this is Straight Talk with Laurel Porter.
Hello and welcome to Straight Talk. I'm Laurel Porter. We hear a lot about problems in our community, such as lack of access to health care, including mental health services, homelessness, lack of services for our elders, and help for children transitioning from foster care. When we look to government programs or the traditional medical system, often it seems the solutions can be slow to come. In this episode of Straight Talk, we look at innovative community-based solutions happening here at home, and one that's happening across the world, training grandmothers in Zimbabwe to help people with depression. It's something called the Friendship Bench. We'll see how that works and what we can learn from it. I'm pleased to welcome our guest, Dr. Derenda Schubert, Executive Director of Bridge Meadows in Portland. She's a psychologist and she's a champion of intergenerational solutions to complex social challenges. Dr. Rachel Solotaroff is an MD and the president and CEO of Central City Concern in Portland. And later, we'll meet Dr. Dixon Chibanda, a psychiatrist in Zimbabwe. We'll talk to him about the Friendship Bench and grandmothers as mental health advocates. First, Rachel and Derenda, welcome to Straight Talk. It's so wonderful to have you both here.
Thank you
It's
for
great to
having
be
us.
here. Thank you, Laurel.
First, what do we mean by community-based health and a community-based health approach, and why is it important? Let's begin with Rachel from Central City Concern.
Great. Thanks, Laurel. You know, I think of community-based health as grounded in that idea of deeply listening. And that is really at the core of what Central City Concern has done for the past 40 years or so. The mission of Central City Concern is to not to just deliver widgets, to deliver services, but to actually try to solve a problem, to figure out how we advance solutions to the problem of homelessness. And the only way to solve that problem is to listen to the people who have experienced it and can help design and drive those solutions. And also knowing that the solutions which may have worked 2 or 3 years ago, or maybe even 12 months ago, might not work today. So that process of listening and engaging, designing, implementing, listening some more, designing and implementing is really core to what, in my view, in my colleagues' view, community-based health is all about.
Thank you, Rachel. And Derenda, how do you define health, and why do you think a community-based health approach is so important at Bridge Meadows?
Well, health at Bridge Meadows is living with intention and flourishing and living your best life, being surrounded by people who care about you, feeling a sense of belonging, having a reason to get up in the morning and living with purpose. One of our young persons says, so most people have only 2 grandmothers. I have like 42. And what that translates to me and the sense of health is that this child knows that he is not alone, and he has not only his family and his siblings who care about him, but he has his entire community of people who care about him. And when we have more people than 1 or 2 care about us, we really have a sense of groundedness, and that can help us flourish. It's also being with people who understand your life experience and who can meet you where you're at and provide support and listening, as Rachel just said. It's also having stable housing, access to food, and access to good schools, and access to what we need to live our best lives.
Can you tell us more, Derenda, about how Bridge Meadows works? People may not know the model, and maybe a story about how you've seen innovation at work there.
Sure. Bridge Meadows, we create intergenerational communities for a very special purpose, and our purpose is to support children who've experienced foster care. We support their forever families and elders who live with meaning and purpose. So it's 3 generations coming together to live and flourish together. We have a contract with the state of Oregon Child Welfare System who sends families to us. And then elders have learned about us from all of the incredible media we received nationally and locally. And they want to live with a sense of I matter. Still have things to give. I still want to I want to have a meaningful life. and contribute. And what better way than to be supportive to children as mentors and as surrogate grandparents? And it's really, if you boiled it all the way down, it's really about neighbors supporting neighbors.
And Rachel, what about at Central City Concern? Tell us about the work you do there and what innovative approaches you've taken.
Yeah, sure. So at Central City Concern, as I talked about, we are working to provide solutions to homelessness. And so in pursuit of that, we provide services in a handful of areas. So we own, manage, and provide services in over 2,000 units of supportive housing across the metro area. We provide supportive employment services with the idea that anybody who wants to work can work. And we also provide comprehensive health care, which is inclusive of primary care, of addictions care, of mental health care. And then the fourth element I think of is really the secret sauce of Central City Concern. It's woven throughout all of our services, and that's peer support. Kind of similar to what Derenda was prescribing, people who have that lived experience walking alongside clients, walking alongside patients and residents, helping to sort of guide them along their journey because maybe that peer is a couple years further along, and can really help to chart that course for an individual. And I think the innovation really comes from saying that, you don't need just one thing. You kind of need all of these things, and they look a little different for different populations or different people. But the innovation comes from saying, how can we weave these things, health and housing and employment and peer support, weave them together in a way that is really synergistic, where each of the interventions kind of plays off of one another and the whole becomes greater than the sum of its parts. And again, that might look different, what a young person, anyway, for different populations, it may look different. And so the innovation can take a lot of different forms.
And Derenda, we talked about this a little bit about isolation. During the pandemic, we've learned a lot about isolation. It's something that can really take a tremendous toll on people. What impact have you seen Bridge Meadows have on social isolation? And what do you think the larger community can learn from that?
What we've seen about what we know about social isolation is when we live this way in a socially isolated way, we are so much more at risk for harm to our health and our mental well-being. And what we see at Bridge Meadows, some of the innovation there, as Rachel was saying, it's a housing community first and foremost with a purpose. And the purpose is that the community members are going to support one another. And so we bring together housing, we bring together mental health services right on site, and we bring together peer support, as Rachel was saying. What we have seen with Bridge Meadows and social isolation is that that everybody was caring about each other, and the neighbors were helping neighbors, helping with meals, making sure folks had access to food, and the elders were helping the children with school so that the parents could go to work. They were doing that safely, masked, 6 feet apart, in the courtyard, using Zoom and all of those other digital platforms to help them do that. And so when you are living connected, your risk of social isolation decreases. And our Surgeon General has stated that social isolation is an epidemic and as bad as smoking 15 cigarettes a day. We don't think about that. We think, oh, it's kind of nice to have friends who care about you. But actually, it's one of the most important things we need to do for our health. And the global pandemic really illuminated the importance of us being connected.
Thank you, Derenda. And I know, Rachel, you also try to tackle that social isolation at Central City Concern. You've been talking about this holistic approach to health. What are some interventions, maybe some stories people might not think of that can help with a person's health and help them heal?
Well,
I know you talked about maybe helping somebody with a pet.
Of course, yeah. And I'm thinking about that in the context of COVID as well, where sometimes the things which have been instrumental to someone in maintaining their support and social connection may be at risk with COVID. If someone is, what we found is, for instance, if we were concerned that someone had been exposed to COVID and needed to remain in their home in isolation, what would be all the things that they would need to be able to maintain that kind of connection? And sometimes it is these what you think of as the basics: delivery of food, delivery of medication, but also our residents told us, gosh, I have pets here. I would need someone to help take that dog for a walk or to ensure that that dog has food. It's those small things that make a big difference. I always say one of the best lessons I learned in medical school was when one of the professors said to me, do small things with great love. And I think in this time in particular, that axiom really rings true.
It's a wonderful motto to live by. Derenda, do you foresee a time when we'll see more communities like Bridge Meadows?
I do, Laurel. We every day, we can't build Bridge Meadows communities fast enough. I should share that with you. We have a very long waiting list because people are really wanting to live connected to one another and feeling like they belong and feeling as though they matter in this world and what they have to give matters in this world. And we are seeing an increase. The United States is seeing an increase in communities of color growing. I just read a statistic that said 4 out of 10 people identify with a race or ethnicity that is not white. And we know that in the Black, Indigenous, and people of color communities, more living intergenerationally and in community is natural. It's what everybody does. It addresses issues of childcare so parents can go to work. It addresses housing stability. And it's a beautiful safety net. And here we are making that happen at Bridge Meadows with people who come from all over the country to take good care of each other, whether it's a grandmother adopting their grandchildren who've been in foster care or an elder who comes from Manhattan because they want to live in community. So we are seeing more and more people asking us to come to different cities to make Bridge Meadows communities. And we're seeing more and more of our friends in the BIPOC communities who are saying, we need to live intergenerationally and we need to live connected. And we're honored to keep doing it. I want to not have a 2-year waiting list for elders at Bridge Meadows. That's a goal we have.
We only have about 30 seconds left, but I wanted to ask Rachel, what is your hope for the future?
Well, I would say that we think about this kind of integration of these solutions being in synergy, that we don't think of it as innovation anymore, that we don't set up solutions that are isolated, but we know how to weave them together, not just at the ground level, but really at the system level, at the state level, at the federal level, so that this kind of interplay of different supports to help end homelessness becomes our best practice and not just an innovation.
Rachel and Derenda, thank you so much for joining us here on Straight Talk. Thank you for the good work you're doing. If you'd like to find out more or donate to these nonprofits, here are the links to their websites at Central City Concern and Bridge Meadows. Coming up next, how a simple bench and a team of grandmothers is taking on depression in Zimbabwe and what we can learn from it here. We're back in 2 minutes. Welcome back to Straight Talk. I'm Laurel Porter. We're talking about innovative, community-based solutions to healthcare, including mental health. And this one that started in Zimbabwe is truly unique. It's called the Friendship Bench, and it trains grandmothers to be mental health counselors. I'm pleased to welcome Dr. Dixon Chibanda, a psychiatrist, professor, and founder and CEO of the Friendship Bench. Dr. Chibanda joins us here on Straight Talk from Harare, Zimbabwe. Doctor, thank you so much for joining us here on Straight Talk. It's a pleasure to have you here to talk about your innovative community-based solution to addressing mental health.
Thank you. Thank you. It's a pleasure to be part of this.
Well, first of all, tell us about the need. What is the situation in Zimbabwe when it comes to mental health and the number of care providers available?
Well, Zimbabwe, like any of the other regional countries or low and middle income countries, has a great need in terms of mental health. The treatment gap, as we call it, for mental, neurological, and substance use disorders in Zimbabwe is massive. You have a ratio of 1 psychiatrist to about 1.5 million people. So the need is massive.
So what sparked the idea for the Friendship Bench? I know there's a really interesting story behind what gave you the idea.
It was really mainly a tragic loss of one of my clients, who I talk about extensively in my TED talk. Erica was her name. Erica took her own life, and the reason why, you know, she kind of took her own life was because they really couldn't come to the hospital where I worked at the time as a psychiatrist. And so that loss of Erica, you know, was the trigger for me to start thinking of how best to take mental health to the community so that people don't have to actually come to the hospital to get services.
Well, tell us how the Friendship Bench works. How do you choose and train the grandmothers, and what exactly do they do?
So the model is pretty simple. What we do is we train trainers from communities across the country who then go on to train grandmothers in those communities. We allocate wooden park benches in those communities, and we facilitate referrals to the benches through social media, through the radio, and through primary healthcare facilities. And after a few sessions on the bench, clients are referred to join a support group in their communities. And in essence, that's how it works. And all of this is rooted in empirical evidence. We have over 50 peer-reviewed publications about the Friendship Bench. So it's really rooted in science.
How do you choose the grandmothers, and how do you go about training them?
The grandmothers are normally selected within their own communities by people who are respected in those communities. The city health department is involved, church organizations can be involved, and they have to be grandmothers who are rooted in those geographical localities where we are introducing the Friendship Bench. And the reason why we do that is because we strongly believe that you know, grandmothers who have lived in a particular area, you know, are very much familiar with the local wisdom and the culture, and they are able to assist those communities in which they have lived all their lives.
Can you give us an idea of what one of the sessions might be like with a client?
Yeah, sure. We normally have our sessions run in the local language, which is Shona. And the first component of the session is called Kuvura Pfungwa, which literally means opening up the mind. And so during this session where we talk about Kuvura Pfungwa, what is literally happening is the grandmother is listening to the story. So in other words, the bench really is a platform that enables people to share their lived experiences and their stories. And through that storytelling, the grandmother identifies the problems that a person may be facing. And after that, we move on to the next session, which is called uplifting, or kusimudzira, where they identify a problem and zero in on a solution, which is very specific, measurable, achievable, realistic, and timely. And from there, they strengthen the ability of the client to go on to resolve that problem once they get home. So in a nutshell, that's what they do. But obviously, there are other components which are linked to behavior activation and activity scheduling that the grandmothers will provide during that session.
How successful, doctor, have you been? How many people have you treated?
In the last 4 years, we've reached over 80,000 people. And the impact itself is measured, as I indicated earlier on, through a number of peer-reviewed publications. And one of our biggest publications is in the Journal of the American Medical Association, which is a cluster randomized controlled trial, which shows that 6 months after receiving therapy from a grandmother on a bench, people remained symptom-free from depression and did not have suicidal thoughts.
Well, that is successful. Why grandmothers? What's special and unique about them that makes this program work so well?
Well, firstly, in this part of the world, and I believe in most parts of the world, grandmothers are the custodians of the local culture and wisdom. And grandmothers are truly rooted in their communities, and they create that glue that brings the community together. And they are approachable, and they are good listeners, and they also are very good storytellers.
Well, I'm a grandmother. I hope that I'm like, like that. What impact have you seen the program have on the grandmothers?
Well, that's a great question. You know, when we first started, we were actually concerned that the grandmothers would be overwhelmed with all the challenges and all the problems that they were having to address. But, you know, ironically, a few years ago, we carried out a study to look into the mental health of the grandmothers who were working on Friendship Bench. And what we found was that Friendship Bench actually was very protective against mental health challenges when we compared the grandmothers who were working on Friendship Bench versus grandmothers who were not working on the Friendship Bench. So in a nutshell, it has strengthened the grandmothers, given them a sense of belonging in their community and a sense of purpose as well. So it's a win-win, actually. They are providing a service to the community, and it's helping the grandmothers to have a sense of purpose in those communities as well.
As successful as this is, it is non-traditional. Have you met much resistance from the medical profession to this unique approach to mental health care?
When we first started, definitely there was a lot of resistance. You know, no one really believed that, you know, grandmothers with minimal education could go on to deliver, you know, aspects of cognitive behavioral therapy, which is normally delivered by trained psychiatrists and psychologists. You know, so there was much resistance. And this is one of the reasons why the Friendship Bench is truly rooted in empirical observation. And we publish everything that we're doing in peer-reviewed scientific journals. So now, obviously, there's a lot more acceptance of the program because of all the publications and the results that we're having both at community level and at national level.
Have you been able to expand the program beyond Zimbabwe?
Definitely, yeah. We've introduced the model in Malawi, in Tanzania, in Zanzibar, in Kenya, and we piloted Friendship Bench in New York City as well, in the Bronx and in Harlem through the New York City Health Department. Yeah.
What do you think that we can learn here in the U.S. and in Portland, Oregon from the Friendship Bench model?
I think the key lessons really is that every one of us can provide support, mental health support in our communities. You don't have to be trained. You don't have to be a psychiatrist or a psychologist. You know, the key lesson here is, you know, we need to have empathy and, you know, and the ability to really make people feel respected and understood. And that is pervasive. That is a pervasive global thing that you can have everywhere. You know, you don't need much training for that.
You were really inspired by coming up with this based on the tragedy that you experienced. What's your next goal? What's your dream, if you could dream big, Doctor?
My big dream, which is the vision of Friendship Bench, is to have a Friendship Bench within walking distance everywhere, because I truly believe that if we can make it possible for communities to support each other globally, we will make the world a better place.
Can you tell us briefly maybe a story about a real success story that you've had through this?
Well, there are many success stories. Just last week, I was having a chat with one of the grandmothers where we were talking about a client that had come to the bench. And this client was living with HIV and was struggling to come to terms with their HIV status, and were actually contemplating suicide. And through a series of sessions on the bench with a grandmother, using the steps that I indicated earlier on, this client eventually, you know, got out of this depression, and they began to see the light, and they are now actually back at work and supporting their family. You know, so these small little stories, you know, have such great impact in the community and in families as well. Because this is a breadwinner who was about to you know, terminate his own life, but by going to the bench, sitting down and talking to the grandmother, the person has transformed. You know, and we have lots of these kind of stories on a daily basis in our communities. Thank you.
Dr. Dixon Chibanda, thank you so much for joining us here on Straight Talk. Thank you for your good work. If you'd like to learn more about the Friendship Bench, here's the website, and I'll include a link on this story on kgw.com and on the KGW app. Thank you for watching and listening. Remember, you can get Straight Talk as a podcast. Search for KGW Straight Talk. We're off next week for the Memorial Day holiday. We'll see you in 2 weeks for Straight Talk.